As we cover your health tonight, fertility rates in the U.S. just hit an all-time record low. News 15's medical editor Dr. John Lepre examines how Louisiana fares with having fewer babies and the impact of low birth rates overall.
The U.S. birth rate's at an all-time low, but there may be pros and cons. So let's take a look at this latest report by the CDC. Starting with the historical data, the birth rate peaked with the baby boomers between 1946 and 1964, and there's been a steady decline ever since. Contributing events include birth control in the 1960s, the recession in 2007, and COVID in 2020. Now, from the baby boom to present, there's been a 48% drop in the birth rate, an all-time low, and another 5% drop is predicted by 2030. Now, Louisiana is about average at 6.2 births per 100 women. The U.S. average is 5.8. The highest is South Dakota, the lowest is Vermont, and Mississippi in between. Now, some very interesting trends explain why the birth rate is dropping. More women continue education after high school, going from 5.2% in 1950 to 37% today. And with that comes increased job opportunities and waiting later to have children, the average age going from 23 to 27. And finally, having less children, averaging 3.5 in 1950 and 1.7 today. Now, there are pros and cons to a declining birth rate. Let's look at the positive side. A decreased population places decreased demand for resources like food and energy, and an ease on the housing crisis. And of course, it's less expensive. Fun fact, it costs an average of $230,000 to raise one child in the U.S. However, there is a downside to a decreased birth rate. The population will age, and with that comes higher costs from the elderly. Also, without younger workers to replace us, the retirement age will increase, so I'll be around a bit longer. Reporting on your health, Dr. John Lepre, News 15.